Hello, everyone. The next speaker is going to be Dr. S. Natarajan. Dr. Natarajan is the past president of All India Ophthalmological Society, on the executive committees and leadership positions of several other societies, both nationally and globally. And I believe he's also a member of the executive committee of International Council now. Dr. Natarajan is a very renowned retina specialist all over the world, and he's going to tell us about ophthalmic epidemiology and prevention of blindness, meeting global eye health needs.
Thank you, Nag, and thanks to Namrata for giving ICO a session here in All India Ophthalmic Society. I want to quote Helen Keller: the only thing worse than being blind is having sight but no vision. And we as ophthalmologists have to have vision for our own countries. And the objectives of discussion: to discuss the burden of global blindness, to discuss causes of blindness, to discuss strategy of blindness prevention. So here you see corneal blindness is 1%, the other is 6%, glaucoma is 6%, refractive errors is 20%, and we have cataract 62%, and posterior segment is about only 5%. So diabetic retinopathy is a preventable blindness, and I'm talking about the posterior segment diseases, and we have age-related macular degeneration, iridomacular degeneration, and others. Approximately, we have now, as of today, 100 million diabetics, with 58% do not know that they have diabetes. Globally, at least 2.2 billion people have vision impairment. Leading cause of vision impairment and blindness is refractive errors and cataract. Vision impairment poses global financial burden, with the annual global cost of productivity estimated to be US dollars 411 billion. And the burden estimates and the secular trend of blindness and vision loss, years lived with disability, global, regional, and national levels, age standardized the YLD rates, and estimated annual percentage changes, and the EPAC estimated annual percentage change ASIOIs due to blindness and vision loss decreased from 359.46 in 1990 to 327.98 in 2019 per 100,000 population. The global ASIOIs per 100,000 increased from 94.26 in 90 to 95.81 in 2019. So the YLDs for blindness and vision loss were calculated by the prevalence multiplied by disability weights for the health state associated with blindness and vision loss. And the crude YLD rate due to blindness and vision loss at different age groups globally. And here females had higher ASYRs than males in 2019 in terms of blindness and vision loss. And this is a paper by S. Lee et al. And the global burden due to blindness and vision in 204 countries or territories, the ASYRs were the highest in Oman for moderate severe vision loss, followed by India. And the highest ASYRs were in South Sudan for blindness and in Nepal for presbyopia. In 2019, the ASYRs due to blindness and vision loss was highest in South Asia and lowest in high-income North America. And the epidemiology of vision morbidity in India, highest prevalence was seen in Bijnor, UP, whereas the lowest was seen in Thrissur, Kerala, thanks to the work by Praveen Vashist, who is with us right now. And this one is again the work by the Praveen Vashist, seeing the severe, moderate, and mild, and MSV1, which shows the prevalence and causes and types of blindness. We have, as I mentioned, cataract, uncorrected refractive error, glaucoma, posterior segment pathology, corneal blindness, and others. And types of blindness: economic blindness, social blindness, manifest blindness, and absolute blindness. The International Agency for the Prevention of Blindness, where our NAG was the president in the past, Global Alliance of Eye Health Organization for Blindness Prevention Activities. And in India, we have National Program for Control of Blindness, launched in the year 1976 with the goal to reduce the prevalence of blindness. And major activities under the program: primary, secondary, tertiary eye care services, and infrastructure development and capacity building, with apex at the aims with Dr. Praveen Vashist. And 2030 Insight, the future of global eye health, global strategy on WHO World Report on Vision, the Lancet, Global Health Commission on Global Eye Health, and the landmark UN resolution, Vision for Everyone. And this was actually in the UN raised by a Bangladeshi member. The objective is no one experiences unnecessary or preventable sight loss, and everyone can achieve their full potential. Eye care and rehabilitation services are accessible, inclusive, and affordable to everyone, everywhere, whenever they are needed. People understand the importance of caring for their own eye health and demand access to services free from the weight of any social stigma. And elevate vision as fundamental economic, social, and development issue, integrate eye health in wider healthcare systems, activate patient, consumer, and market change, and grant and aid for cataract operations in government sector and NGO private sector, reimbursement for cataract operation for NGOs and private practitioners per case, assistance for cataract operation for government sector per case, and also the NCBB is also giving now for diagnosis and treatment of diabetic retinopathy, ARMD, and retinal detachment. And the International Diabetic Federation estimates by 2030, 8.4% of India's adult population, 100 million, will have diabetes. But the Indian study by Madras Diabetic Research Center says already this year in 2024, we have 100 million diabetics. And prevalence of diabetic retinopathy in diabetics is 21.7%. They're published by the AIOC in IGO. Lack of awareness of the disease, fairly long asymptomatic stage, visual impairment occur when diabetic macular edema or proliferative diabetic retinopathy sets in. And these are the various data report from diabetic retinopathy prevalence, work done by the AIOC group and in Maharashtra along with Dr. Gadkari in Pune. And these are the different models for screening. The Scotland has a 3 gatekeepers model. India has the Arvind model. Then Latin American and the Caribbean with a limited logistic and technical skill. And we have our own model in Mumbai and Maharashtra, screen, diagnose, and treat. We have a pre-camp awareness, assembly of diabetics, capturing of images and diagnosis by ophthalmologists, and same thing to be done in the state level, district level, and all over India. I don't have any financial interest. We use this mobile phone attached to the infrared device made by Remedio, can be mounted on a suitable bike for transporting for screening purpose, can be mounted on any table. Both mobile and the infrared device can be charged. And this is a comparison on a fundus on phone and size. And this is the one how it can be used by anybody. And I call this as a ABCD. Anybody can be used for screening for diabetic retinopathy. And most of the Indian, we have 1 billion smartphones in India with 1.4 billion population. They can use this, and the media software will tell whether the photograph has been taken well. And this can be used by anybody who's a literate or a illiterate. Only thing they have to handle the mobile phone, and the blue things is incorporated AI within the phone. And so the expected outcome, early detection and treatment after screening can reduce the prevalence of diabetic retinopathy even in the remote areas, reduction in the economic burden among poor and illiterate people, opportunity for a non-skilled worker to be trained as a semi-skilled worker for doing diabetic retinopathy screening. It will help to improve overall health of the population, because we are also doing HbA1c, BP sugar for all the patients above the age of 40. And if they are diabetic, we do a free diabetic retinopathy screening. We also made a not-for-profit company to do this for the whole country, and the future plan is we are doing with the Mumbai Municipal Corporation. We have about 200 called a Family Health Center. Now it's called Apla Davakhana in Marathi. And the same thing has been done by Shova Prasad in Kerala. It was a success where they used the AI and used 3 diagnoses. They had started in 16 family health centers with 4,000 patients, and later they expanded to 250 centers. They found 1 in 3 patients with diabetes, and this is what they did in the Kannur hospital. Similar model to introduce all over India, and this is a preliminary thing they did that. And this top blindness program, which I started in All India Ophthalmic Society, can be extended to all the NGOs, and hope that India can do that. And welcome you all to the International Council of Ophthalmology World Ophthalmology Congress to be held at Vancouver, August 16 to 19. Thank you.